Hello everybody, my name is Sharon and welcome to my Bmsc 207 presentation for assessment task 2. So as you can tell by the slideshow, the topic that we will be discussing today are COVID-19 vaccinations, and the actual topic is what safety concerns have been raised for COVID-19 vaccines. So let's get started. Okay, so first of all, an introduction to vaccines. What is COVID-19? What is a vaccine and what vaccinations are available for coronavirus? Alright, so coronavirus 19, also known as COVID-19, is an infectious disease that is caused by SARS-CoV-2. This disease mainly affects the respiratory system and appears externally through symptoms of two types of respiratory systems, and those systems are the interstitial pneumonia and acute respiratory distress syndrome, which is also known as ARDS. As you know, right now we're going through a pandemic and COVID-19 is all around the world right now. Therefore, it's everyone's responsibility to practice good hygiene whether you are affected or not, in order to protect everyone around you and to protect yourself. Statistics show that globally over 5 million people have been infected by coronavirus, and even though this number is going up every single day, every single minute, the number of people that have been cured is also increasing as well. Infectious disease physicians, pneumologists, and intensive care physicians are only a small portion of the medical community that have been involved in studying the nature of the disease and the severity of the pathogen in order to further develop new cures, new vaccines, in order to keep up with the new strains that are coming up as well. Alright, so what is a vaccine? Vaccines are generally created to trigger an immune response in our body. It identifies the foreign body and it eliminates it straight away before it can cause any lethal damage to our body or cause an infectious disease. There are a variety of vaccines that are being developed for COVID-19, and so when the medical scientists are trying to make the vaccine, the COVID vaccine usually uses the coronavirus spike. As you can see here, this is what the coronavirus spike looks like, to cause the immune response. The individual's immune system identifies the protein, it identifies it as a foreign body, and it begins to produce longer lasting immune cells and antibodies. Therefore, if a vaccinated individual comes in contact with someone that has been exposed to COVID-19, the body's immune system will launch a faster and better immune response to get rid of that disease because it is already used to it because of that vaccination. So what vaccines are available for coronavirus? So it's already public knowledge that there are 2 vaccines available for COVID-19, but other vaccines are also being developed to protect us from the disease as new strains arise. So the 2 vaccines that I'm sure you already know about is the Pfizer vaccine, which is given to people aged under 50, and the AstraZeneca vaccine, which is given to people over 50. So there are also side effects that happen when any vaccine is given to anyone, such as muscle pain, tiredness, chills, fever, headaches, and also tenderness or pain at the site of injection as well. Alright, now we're going to talk about challenges and issues of the COVID vaccine. So first, before we go into the first dot point, TTS, we're going to talk about different groups of individuals that need to take extra precaution. So different individuals, or everyone should always be knowledgeable and aware of the risks and benefits when it comes to the COVID vaccine, and the benefits should always outweigh the risks. And so some of the particular groups that should be careful when considering taking the vaccine is women who are breastfeeding, women who are pregnant or planning to get pregnant, the elderly, people with a disability, so people with weakened immune system, so those immunocompromised, and those with a history of blood clots as well, and we'll get into that in a minute. All right, so now we're going to get into that. So TTS is a side effect that has been newly discovered from the coronavirus vaccine. So TTS stands for thrombocytopenia syndrome, which is basically blood clots occurring in body sites like the brain or the abdomen, which is the thrombosis part of it, and together with low platelet levels, which is the thrombocytopenia part of it. And this usually occurs between the 4th and the 26th day post-vaccination, so after you've had your vaccine. The overall prevalence of TTS around the world is between 4 to 6 cases per million. It is very low, but it is greater within people under the age of 50. So within under the age of 50, it is 20 to 40 cases per million, which is much higher than globally. Because the vaccine is fairly new, the mechanism of how TTS occurs is not fully understood, but current and up-to-date research shows that it is similar to reaction that occurs from therapeutic heparin anticoagulation. So when blood clots arise, not all blood clots come from COVID-19. If you do get a blood clot, make sure you see your GP and get further tests done if needed. Okay, I'm just going to check if you're filming. Okay. Alright, so now we're going to get into so the two groups of people that we're going to talk about is immunocompromised individuals and women who are pregnant as well. Okay, so immunocompromised individuals are those with a weakened immune system. It includes people who have a medical condition such as HIV, or those taking medication for cancer, or transplantation drugs as well. But it does decrease their immune system, and those in general don't have a great immunity. The Australian government strongly recommends immunocompromised patients to receive COVID-19 vaccine, in particular the AstraZeneca vaccine. Because they recommend immunocompromised patients to take the AstraZeneca vaccine only because it contains a virus that has been modified and will not develop to affect the other cells in the body. Therefore, it doesn't cause any infection. If an individual that is immunocompromised is about to get the vaccine, they should be prepared and researched, and the benefits should always outweigh the risks. All right, pregnant women. So women who are pregnant obviously need to take extra precaution when considering taking the vaccine. They have another little human growing inside of them, so they need to be extra careful in what they consume. So it is not recommended by doctors for pregnant women to have the COVID-19 vaccine, but if the individual is considering it, they should take the Pfizer vaccine, which is what doctors recommend. If it's not available, they can take the AstraZeneca vaccine. It is okay. Doctors recommend that. Both are okay, but as long as the benefits of each vaccine is outweighed by the risks. There was a clinical trial that was done that was conducted for pregnant women in aged 18 to 25, and they showed common symptoms of muscle pain, headaches, fever, chills, tenderness, and pain at the site of injection. Because this is a new field, like coronavirus is new, many clinical trials are still being done, and so results will come within the next few months. Okay, Now we're on to the next slide. So theories used in microbiology and immunology. So back in the day, people such as Koch, Pasteur, and all of them used many theories to prove their points when dealing with microbiology and immunology. And so there are many theories that can possibly relate back to coronavirus as a whole. But one of the theories that my research led to was Louis Pasteur worked when he was working from the middle to late 1800s. He worked to prove the theory of the germ theory. So what Pasteur studied was he studied substances such as milk and wine, and he was studying why they became sour after a little while. And so he finally observed that the bacteria was the cause. And he observed the importance of microorganisms in everyday life and convinced other scientists that if the bacteria would make the substances sour. And so he concluded that if bacteria can enter a substance such as milk and wine, what is stopping bacteria from entering human bodies and causing human illness and infectious diseases? So for this reason, practicing general hygiene is so important to prevent the spread of any germs, prevent the entering of any germs to our body. So practicing general hygiene such as sanitizing, social distancing, not being in contact with any infected people, being extra careful when coming around food, and just to protect yourself and protect others as well. The next theory was the golden age of microbiology and antibiotics. So this also relates to COVID-19. So during the golden age of microbiology, many diseases were identified, and therefore scientists were able to discover agents which then led to decreased epidemics and statistics, and eventually terminating the spread of some diseases. Antibiotics were then introduced to medicine, which also aided in the exponential decline of infectious diseases. So in today's day and age especially, antibiotics also play a major role in sickness and in health. So whenever you feel like you have a fever or a blocked nose or something, like we go to the doctors, they prescribe antibiotics, and if you're consistent with that, then you feel all better. So just like back in the day when there was a decline in infectious diseases, it also happens now. Antibiotics work in the same way in this current day and age, in aiding in the immune system in the destruction of pathogens, such as the treatment of TTS. So it is also used to treat the thrombosis and the thrombocytopenia. So just in conclusion, so we're just going to talk about quickly the supply and demand of vaccines to other countries. So the supply and demand of COVID vaccines around the world puts everyone in extreme danger. The money, resources, and facilities that are needed to provide people with the vaccine, as much as it will help the country tremendously, can also put the country in peril. For example, with circumstances that are happening in India right now in the past few months, show how extreme and difficult it is to accommodate an overpopulated and underdeveloped country. As a developed country, in Australia and other countries in the world should join together and provide resources to improve the situation. And it's now a time to break the cycle of neglect that has characterized our response to endemics and pandemics. So CEPI, also known as CEPI, is an alliance to finance and coordinate the development of the new vaccines and prevent and contain infectious diseases epidemics. So CEPI is a worldwide organization, obviously. It's helping countries all around the world. It has a $3.5 billion plan of action to substantially reduce the global pandemic and the endemic risk. With the help of this money, countries all around the world can get really far. Alright, in conclusion, the fight against coronavirus will not be won until every country can get it under control. The problem is that not every country has the same facilities and ability to protect a country and its people. Underdeveloped and overpopulated countries need the authorities to make major adaptations if there is going to be a change in the directions. Other wealthy countries such as Europe, Asia, and North America suggest the basics such as keeping good distance from others, washing hands thoroughly, staying at home as much as possible, especially when you're sick, having good sanitation when around food, and just being cautious in general. Those are my references. Thank you for listening.